Welcome back to Healthwise with Dr. J.Y. Bordelon from the Opelousas General Sleep Center. Doc, we were talking about different diseases, or we were starting to talk about, sleep disorders. How would a person present if they were having these sleep disorders?
Well, interesting. The things that people should look for: being tired, waking up, say even on weekends when you'd normally have enough sleep, and still not being rested. Having family or friends complain about your snoring, and occasionally patients will, the family members will notice that there's a pause in your breathing and some sort of a weird noise, snorting or grunting or gasping, and those are probably the more common things we hear. People come to us because they're tired and snoring, but it's the complications that the big deal that we have to prevent.
Well, you're saying that, I was just getting ready to ask you, people might say, oh, it's just about snoring a little bit or fatigue, but what else? What are some of those complications?
Well, high blood pressure is probably the most, or the best documented complication. 1/3 of high blood pressure is due to sleep apnea. And as time goes on, people develop enlarged hearts, heart failure, increased risk of strokes and heart attacks and sudden death. One of the people, I'm sure you're familiar with, Reggie White, a very successful pro football player, was 41, 42 years old when he didn't wake up one night. He had sleep apnea and had some difficulty adapting to his treatment. And the Reggie White story is one of the ones that you can go and read about on the net that talks about some of the complications of sleep apnea.
Sure. Well, Doc, what are some of the other things you see? Well, before we do that, sleep apnea. Explain to our audience exactly what is sleep apnea.
Well, what happens when we go to sleep, the upper air, our body relaxes, and so the tissue in our upper airway will relax too, and the tongue, the soft palate, the little uvula that hangs down, all of that will start vibrating as we're breathing in and out. That's the snoring noise, the vibration. That's what disturbs everybody. But when we pull air into our lungs, the airway, all of that tissue comes together, and it's like somebody's put a stopper in the sink. There's no air flowing into our bodies, and with that, no oxygen. That's the thing that keeps us running. So because we're asleep, it may be 10 seconds to even a minute or so before the body recognizes that there's a problem and initiate that extra effort that gets us breathing again. When we walk in to see a new patient, it's interesting. You'll have an adult man sitting in there, and there's all of his family, because they want to be sure that the message gets out. It's impressive. I mean, you think it's snoring, but the whole family is upset with it. I hadn't seen anything like that unless I was back doing pulmonary when we were talking about a lung cancer or something like that. And they want to make sure that the whole message gets out. Sometimes they'll come in with tape recorders, and now that you have all the cell phones, they'll come in with videos. And so it's the patient doesn't realize, because he's asleep or she's asleep, and it's the people that are around that see what's really happening.
Well, I've heard, firsthand, some of my coworkers, and I work in a field where we sleep. We work a 24-hour shift, sometimes 48 or more, and it's on again, off again. So, sometimes, especially when you're real tired, your coworkers, it's like they're snoring so loudly that there's just no way possible. It sounds like somebody's felling trees. They say that, and is that necessarily a bad thing that someone snores loudly?
Snoring by itself is not a terrible thing, and there are times where we'll do a sleep study and there's nothing but snoring there. It's more the exception than the rule, because if you snore and you wake up tired, there's sleep apnea. If you have a big neck, 17 inches on a man or bigger, you probably have sleep apnea.
Really?
Yeah.
So most of the time, 17 inches. Oh, I have to go measure my neck size now. I think
Yeah.
I'm 18.
Yeah. You know, the other, you know, we talked about the high blood pressure, but the drowsy driving, that's a really kind of a scary thing. You drive along the road and you'll see all these little crosses on the, that's not for old folks, that's for young kids that are falling asleep and having accidents because they just overdid it and they didn't realize, you know, what was happening, and they kept trying to drive through it. Yeah.
So okay, so sleep disorder is not necessarily just for older people. I mean, well, how about, do you get babies with sleep disorder?
Absolutely, yeah, you know? Absolutely. You know, there was a SIDS epidemic a few years ago, and a lot of that was corrected by changing the position and not having them all bundled up to where they couldn't breathe. But young children will have sleep disorders, and a lot of some of the problems in grammar school, the ADD and the ADHD, some of that is sleep apnea. There's overlapping symptoms, and pediatricians now are looking for sleep disordered breathing before they'll start a lot of the medications.
Wow, so a lot of the problems, like you said, may be not necessarily ADHD or whatever, just may be because the kid's not sleeping.
Yeah.
You and I both said, we were talking during the break, and I think we were saying that kids have PlayStations, they have cell phones.
Absolutely, that's one of the things we have to worry about as a society. You know, years ago, before electricity, everybody would go to sleep when it got dark, and you would maybe read a little bit, say your prayers, get a bath, and basically chill out, getting ready to go to sleep. As things happen, you got telephones and TVs, and the amount of time we had available for sleep has been gradually decreasing. So back historically, people were getting 9 hours sleep, then it was 8 and 7. And now kids are coming in bed, they've got cell phones and texting and Game Boys and laptops, and all of these things keep you so tense, it ruins the chance to get to sleep. And as time goes on, those kids are going to be paying a penalty. They're going to have difficulty sleep. They're going to have insomnia and disturbed sleep the rest of their life.
Okay. Okay, Doc, well, we keep that thought in mind, and we're going to, because I have some questions to ask you about shift work and how it affects sleep, because it affects me, especially. So we're going to talk about that when we come back from this next message from our sponsors.